much to everyone who's joining us today for this webinar. It's really important that we start to think about the message. So I'm Sean Russell, I'm the head of Thrive for West Midlands Combined Authority, and my role is really to amplify the message around good mental wellbeing in the workplace, as well as community focus, to really think about now as we move towards 2021, how are we going to help ourselves in the current COVID pandemic, but also in the recovery element going forward. And I think it's really, really important that we recognise how important people are in all of this work that we do. So you've got a vast array of speakers today who are all experts in their own way around actually the implementation of the programme that they've delivered within their workplace, or actually it's a national level with Erin through Mind, but also Michael Mansfield to talk about the little bits of work that's been doing around the silence of suicide and how the impact of suicide is so important for us to understand the implications for us as employers, but also for our communities. So to start off, we've been very lucky that actually the West Midlands are absolutely right behind this. The Mayor of the West Midlands is really, really committed to ensuring that actually we drive the workplace wellbeing agenda. As Emily says, this is about improving productivity, but it's also about improving the life and chances for our people in the region. We recognise that our region has quite poor health inequalities in general, and therefore we have every opportunity here to try and improve that by improving the workplace agenda and making sure that people are really supported in what they do. Now, I'm very lucky to be supporting a programme through the Midlands Engine, which is literally a very, very important piece of work around mental health and productivity, ably supported by Erin and a number of other partners, including Coventry, Warwick University, Birmingham, Nottingham, and various other partners across the region. And actually our reach is from Lincolnshire in the far east over to Hereford in the bottom of our patch up to Nottingham. So a massive opportunity for us to really think about the 450,000 businesses who are within our area to be able to put this at the centre point of where we are. So it's really important for me really to ensure that actually we get those messages out there as far and as wide as we possibly can. But it's not just about messaging, it's about making sure that people are encouraged to commit to doing something different. Because it's lovely us talking about it, but we have to demonstrate that, and it requires a cultural shift. People at the top need to be able to make sure that actually we drive that ambition going forward. So it may be lovely that we've got some advocates within an organisation who are really keen to drive some stuff, but actually if we're not doing that in a really structured way, it won't have the impact that it requires for that position. But we also know that, as Emily started to talk about, we lose a lot of people through poor mental health out of the workplace. And actually we have a lot of people out of work in our region. 110,000 people actually in the West Midlands who are out of work through poor mental health and poor physical health. So it's important for us to really ensure that we tackle that agenda, because what we want to do is make sure our workplaces are the best they can possibly be, so people are happy and productive, and therefore whenever we put some new employees in, they are likely to stay. So we reduce the element of retention issues, but also therefore that we have a really holistic approach to improving the workplace wellbeing agenda going forward. So there are two things for me I want you to get out of it by the end of the day. First of all is to ensure that actually you've listened to everyone and understand the value of what's on offer from the experts that are going to speak today. But secondly, to remember that actually we've got a couple of days coming up that are really important. So the 18th of January, which is next Monday, is Blue Monday, and it's supposed to be the saddest day of the year, where people start to get the first bills after the Christmas period. So people are starting to feel really, really frustrated. The nights are still dark, really, really complicated. And therefore we know that actually statistically it's the saddest day of the year. The second bit for me is actually on the 4th of February is Time to Talk Day. And it's ensuring that actually we do encourage people to talk about mental health and wellbeing in the workplace. And we've historically done lots of work with programmes such as This Is Me, which will be launching later on in the month. But I think for me, it's important that you recognise that this will be a call to action for you after today, for all the people out there who are listening, to actually take something away and to implement some of the work that you've heard about today in your workplace. So without further ado, I'm going to pass over to Erin now from Mind.
Brilliant, thanks Sean. Hi everyone, just bear with me 1 second whilst I make sure I'm sharing the right slides with you there. Can everyone see those? Brilliant, good start. Yeah, morning everyone, or sorry, afternoon. So as Sean says, I'm Erin, I'm the programme manager at Mind, the mental health charity, really looking after Mind's input to the Midlands Engine mental health and productivity pilot. But I'm going to use my 10 minutes today to just really whiz through some advice from Mind on how you can be supporting your team's wellbeing sort of at the moment. It's going to be a bit of a whiz through, but happy to answer questions afterwards or via email as well. But before I do that, I just want to kick off by asking how everyone's doing today. So at Mind, the majority of our meetings, or sort of team meetings at least, start with what we call a temperature check, which is essentially just a quick check on how everyone's doing, how they're feeling, whether they're doing better or worse than the previous week. And we do this by asking everyone to give a rating or a score out of 10 for their well-being. So 10 being you're feeling fabulous, 1 being not too good and possibly in need of some support. And now we do this as part of our team meetings, and sometimes ask team members to then provide a bit of an update or an explanation on the number they've given. So I'd like to invite everyone here now to pop their wellbeing score in the chat. And whilst you're doing that, I'll role model by giving you mine. So I think today give myself a 7, definitely feeling tired, as I know a lot of us are at the moment, but feeling quite rejuvenated by the fact we're dog sitting this week, so getting out for lots of nice lunchtime walks. So I can see quite a few numbers coming up in the chat. One thing that we do find quite useful to then get people to think about is, especially if they have a fairly low number, think about one thing that you could do today that would increase your score by just 1 point, and then make sure you prioritise time to actually get that done today. So please, again, feel free to share sort of ideas in the chat over how you might improve your score by 1 as well. Conversely to that, if you're feeling quite good, some of the higher numbers I can see, it's really useful to actually just write down why you think your number's that high today. Is it something you've done, something you're grateful for? And it's a really nice list that you can then go back and look at on days where your number's a bit lower. Perfect, thanks for everyone for contributing to that, and hopefully share some ideas as we go as well. So before I sort of get stuck into some tips, I'm just going to very briefly run through this because I'm sure we've all heard it all before. But even going back to before the pandemic, we were already facing a mental health crisis. Now, of course, we've got a whole host of new triggers to poor mental health, including things like social isolation, caring responsibilities, and financial and health concerns as well. So it's really not a surprise that we're seeing more people struggling. In Mind's research, we're seeing well over half of all adults have said their mental health has got worse over this period. And coupling that with issues in accessing support, so we're seeing 1 in 4 adults who've tried to access support during the pandemic haven't been able to do so. And on top of that, we're obviously seeing disproportionate effects on different groups. It seems to be particularly in the Midlands, more effects on younger generations who are in work, those with caring responsibilities, especially homeschooling children, and of course those from lower income households as well. And now how that's actually playing out in the workplace, what we're seeing is less disclosure from employees to their managers if they are having any issues. And those same managers actually telling us that they're finding it harder to spot warning signs as well. Now, if you pair all that with the 3rd national lockdown that we're in and the difficulties that winter itself just tends to bring to our well-being, you know, everything from sort of light levels to hormone imbalances, you can really see why now, sort of more than ever, is the time to look at supporting your teams. So how can we go about actually doing that? Well, first of all, I just want to say that, you know, it's most crucial for you to look after your own well-being first, partly just to role model those good behaviours, but also so that you feel resilient enough to then go out and support your teams. So all the tips I'm about to share, obviously, you know, go for you as well as your teams. So I thought I'd just run through a few ideas that we use in Mind and promote to employers that we work with. So starting first of all with just routinely checking in on well-being, so like the temperature check that we've done today. Promoting sort of those open conversations about well-being is one of the most efficient ways of increasing workplace well-being, and one of the easiest, I think, as well. You know, you can implement these temperature checks to your team meetings each week, and it's a way so that you can actually check in on who may need more support or who's actually coping quite well. Another idea is looking at encouraging healthy activities, so just reinforcing to teams that it's really important to still get outside, especially during the winter, and that can really help with some of those sort of vitamin and hormone imbalances on the previous slide. The days are getting shorter, so really encouraging teams to take a proper lunch break, extended sometimes if possible, so that they can really get out and make use of that daylight and work flexibly around that where possible. A lot of employees do find helpful. And obviously even a small amount of physical exercise is really beneficial to our mental well-being. Thirdly is looking at encouraging the use of wellness action plans. So for the benefit of those who've never come across the wellness action plan, they help employees to sort of identify what keeps them well at work and what might actually impact on their mental health, both positively and negatively. It also helps managers with their employees to come up with ideas together for how managers can spot some of those early warning signs and then support the employee if they are struggling. Anyone can fill them in. They're not sort of specifically created for people who've got a diagnosed mental health problem, but for everyone. Of course, we all have mental health to look after. And Mind have created a specific version of the plan for remote working during COVID. So both versions are available on our website, and I can link afterwards as well. And I think now's a really good time as well, if you've already done your wellness action plans, to encourage your team to actually review them in light of current circumstance as well. Another idea is looking at supporting social activities. So obviously this is even more pressing than ever back in our third lockdown, looking at more creative ways of still really supporting that sort of social side of work as well. And I think especially in the winter, that just tends to be more difficult anyway. So you can try building in time for your team to socialise and get together, albeit virtually. And that can be anything from, say, just dedicating, the first 5 minutes of a team catch up to just chatting about non-work related things, or even dedicating whole periods of time for it. So for example, in our department, we have Friday socials, quarterly catch-ups, where we might do activities together, still doing those virtually, obviously. Or even sort of putting in virtual drop-in tea breaks or lunches on a certain day of the week as well. A few more ideas here. So I think a really major one that we've got an opportunity to do at the moment is to review people's working environment. So to make sure people feel well equipped and supported to work, whether that's from home or still in the workplace, and just asking staff what's working for them, what isn't. We can often find a really simple and easy change in a process, or that bit more flexibility could just make, especially working from home, so much easier. So whether that's looking at the actual environment they're working in, would an extra tool like a mouse or keyboard be beneficial, or whether it's something about being flexible over, say, their lunch times or start and finish times as well. And I think obviously, as we come out of this lockdown, I think where possible, you may wish to consider opening up your office or workplace, obviously with appropriate social distancing protocols in place. But for staff who do find it better for their well-being to be in work as well, it's definitely something to consider. I think really acknowledging and responding to staff's feelings and thinking about what support may be appropriate in response to that is really key. Giving staff and employees sort of a sense of control over what's happening to them and a feeling that their job is meaningful and worthwhile is so important to wellbeing at all times, but especially now. So regardless of what sector you're working in, you can really make sure you're being sensitive to how staff are feeling and feel like they're being listened to and crucially responded to as well. And feeding into that is sort of consulting staff on feedback and getting feedback from them. So at Mind, for example, we went out and we ask every month how people are doing on their wellbeing through an anonymous survey, and ask for ideas over what they're finding useful and not useful, and then update them regularly with what actions we've taken off the back of that. So for example, most recently, we introduced sort of online physical activity classes like yoga. Previously, we've done things like offer reflective practice sessions as well. And finally, I think it's really crucial to say that whilst line managers have a really important role, or business leaders as well have a really important role to play in wellbeing, that ultimately you can't and shouldn't be playing the full role at all times. You know, sometimes people need more support than you can give. And at that point, it's just crucial that people know where to go for more support. So we really suggest looking at your internal communications, so things like your newsletters or intranet posts, and really making sure you're regularly directing staff to, say, your employee assistance programs, if you've got financial wellbeing services or anything related to work, but also third-party resources as well. For example, the Samaritans line or Mind's own info line number as well. And I can provide a list of those in sort of follow-up if people would find them useful. So I'm going to hand over to Michael in a second, but just to say as well, if people want more tools and resources, I'd really recommend looking at the Mental Health at Work website, owned by Mind. So there's a really handy search tool. You can sort of put in who you are, what you're looking for, and everything on there is quality assured, crucially. So you know, it's a bit easier than digging through Google, perhaps. And another thing you can do on there is look at the Mental Health at Work commitment, which is sort of a public declaration that you're making mental health and wellbeing a priority, and gives you standards to work towards with supporting resources to do that as well. So I know I've whizzed through all that, but as I said, happy to follow up with anyone who has further questions. But for now, I'll pass over to Michael.
Right, can you hear now? Yeah, fine. Sorry, just checking. I have to do that every day, personally and with everybody else. I just want to use the time to introduce who we are, because we're very new, and how we've developed, help that we need, as well as help that we give. So the history, in a sense, can be done very quickly, because I have more to say about the present than the past. We started a few years ago, 2015, after Yvette, my wife and I set up this charity, SOS, after my daughter committed suicide and one of her, Yvette's close friends, committed suicide. So it started off in the context of suicide, in order to undermine the really taboo that has surrounded this term, because of course it was a crime, and it still is, to assist suicide. And I discovered very quickly just how many people would want to, in a sense, unburden themselves with the thoughts that they've either had about suicide or those who have committed suicide and so on. So we began an informal network, as it's turned out, of meetings in universities, businesses, community groups, throughout the United Kingdom, and a group's been set up in New Zealand. And the idea is very, very simple. And as far as I know, nobody else has been doing this. I'm just saying that because it's seemingly unique. And it's very, as the best ideas sometimes are, simple. Put in together for one purpose, people who have been thinking about suicide, people who have tried suicide, attempted suicide, people who are bereaved, people who are interested. You put them all in one place or invite them. And the object is talk. As Erin's just said, open conversation. What we discovered was that often that what people said at the end of every meeting was thank you. And we go, why? Because we felt oppressed. Now we feel liberated because we've spoken. So it's the act of conversation has liberated lots of people. However, that's fine when we could have the meetings over the whole of the country. Now we can't do that, not in the same way. And therefore, halfway through last year, we stopped doing that, which left us with a challenge. How are we going to communicate the same idea of overcoming this taboo if we can't speak in groups in the same way? We tried webinars a bit like this, but we found it was quite difficult because you're distant. So in the end, we decided to do what we were not going to do to begin with, but we are doing it, and we are now overwhelmed. What we want to do, and what we are doing, and what Yvette is doing at this minute, which is why she's not here, is training people to take calls. It's like the Samaritans, but it's not identical. The object is a hotline, and we're putting out the message, it's important to talk, because we've moved away from suicide. It's still there in the background. Of course, it is one of the biggest killers for people, women and men, of particular age groups. However, the emphasis is on stress. It is deburdening stress, getting people to talk about, because you know how often the question at the start by Erin, how are you feeling today? A lot of people up to now have always, you just say fine, but then it isn't fine. And so what we were saying when we were linked to, and we still are linked to, businesses, universities, Ministry of Justice, you name it, all the places which you may think of, we've suggested physically, originally, creating a space where people can meet within the institution they work for. In other words, the workplace. However, as a precursor to this discussion, of course, the workplace. Well, where is the workplace? What is the workplace? How is it going to develop? The real question we're all facing, and we are facing on this hotline, set up at the end of August, was just the amount of people ringing in on an individual basis who are not necessarily contemplating suicide or any kind of self-harming, but are desperately worried about what the future really has. We have an unpredictable situation, clearly, an imprecise, uncertain future. And it's in that context that people need to be talking to each other, encouraging, as it were, reaching out to those with whom you work, if you're lucky enough to have a physical workplace, to create a space so that people don't feel afraid, because we found that people are worried that they're vulnerable once they start talking about, especially at this time. This is the thing. Ruby Wax, who introduced our film, which you can see on the website, indicated the same problem. Now, that there is people worried about talking about their vulnerabilities, but once it is accepted that actually you're not going to lose your job if you're lucky enough to have one, but it might lead to a form of resolution in which you see you're not alone, and that other people, your own colleagues, your own contemporaries, your neighbors, who are ringing up in a sense with a state of stress, because even if you got a job, you don't know that by this time next year you'll still have it. And we have very strong links to a number of universities, and of course students are in a particularly vulnerable situation. Now, the difference with the Samaritans is they do a very fine job, and they are listeners. We listen, but we don't give advice. We're not pejorative, but we do intend to ask people questions about themselves, because the biggest thing I think I've come across is that people want to know, is there any hope? Is there, where's it all going? And in a sense, you have to try and deflect from that, because we really don't know. And the sooner politicians wake up to the fact that, their feet are not on the ground most of the time, you can't provide somebody with a precise action plan for the future, except for yourself. The strength of the collectivity of all of us as a society depends on the individual being able to be, as it were, reassured, inspired, and feeling good about themselves for a moment, even if it's only for a moment. Because without that centrality, we're all going to be at sea, literally at sea. So the function of the hotline, which is now running at something like over 200 calls a day, and we're finding it really difficult to cope because we haven't got enough people trained to deal with these calls, who ask questions. They're not intrusive, but it's just saying to somebody, well, if it's that bad, then have you thought, and trying to turn a situation in which there's a little bit of self-analysis, because often that's gone out of the window. It's just they've given up. And it's trying to restore the strength that each of us has locked away in here. So it's unlocking the strength. And this is a rather sort of, it's perhaps less practical than Erin's good talk a moment ago about action plans. So we're trying to do it on an individual basis, one-to-one, confidential, that you can just ring up and talk. And that's what we're putting out on various billboards and so on throughout the United Kingdom. Ring up and talk, don't worry about it. We're not going to be passing any kind of judgment on what the stress is that you're facing at the moment. We're just going to ask a few questions maybe to see if there's another way through, because once individuals realize that they have this strength in them and that they can pass that on, you then get the collective spirit that grows up. Because we're not getting inspiration. We should not be misled by politicians. I'm sorry to be heavy-handed about politicians who, you know, on the one hand say X, then they say Y, then they say something else. Then they're trying to make us believe the vaccine's, you know, going to be, you know, an answer, which none of it is. The answers lie within each of us, not with others. And that's really what we're trying to say. So SOS has now become, if you like, an open conversation for individuals. It's Erin's point, but we're doing it, obviously we're doing it remotely. We would like not to have to do it that way, but we are. Where it's possible to go in on a regulated visit basis, we will do, but it doesn't seem to me that that is in the immediate future. So I hope I've given you a clue as to how we approach this. I don't know whether I've used the 10 minutes or not. I think I probably have, maybe a bit. Oh, I've got 1 minute to go. Well, I just want to say good morning and goodbye for the moment anyway. But we're welcome to ask any questions about how we, there's a website, all the information's there, the telephone lines and the numbers to ring and how we approach it. But it's been hugely successful and very much in demand, and we're pleased to be able to help. Thank you.
Brilliant. Thank you very much for that, Michael. Really interesting debate, and hopefully that we'll pull that out in the questions. So thank you very much for your input. I'm going to pass you now over to Catherine to tell us a little bit about her story.
Thank you. Can you see that? Yes. Sean, is that? Yeah, all good. Okay. So I work for a company called ITP, and we have just completed the bronze Thrive accreditation, Thrive at Work accreditation. So I'm just going to take you through our story a little bit, explain why we started it in the first place, and what we've done pre-COVID and post-COVID. So hopefully it should help some people with a bit of a case study for people that have people still in the office or people that are working from home. So just ITP is Integrated Transport Planning. We're a transport planning consultancy. We have about 45 staff across the UK. We focus this work on our Birmingham office. We have recently formed a merger with Royal Haskoning, so that's taken us to another realm of about 6,000 staff across the world. So bit of a step up, but we're using our foundations to create a very happy and healthy workplace. So why we decided to do Thrive, obviously mental health is very important. It's positive to have positive mental health for both employees and employers. We had practices in place that weren't formal, so we wanted to formalise those into policies and help maybe line managers, if they had anything come up with their staff, that they had a place to go as well as for them, where everything was a bit more formalised for how they could help. So it didn't get to the point where a staff member was in a bad spot before any help was offered. And also, if you have employees now look for a workplace that prioritises mental health, it's a very important thing for people when they're looking for a job. So if you have it in place in your workplace, you are very attractive to your current employees to stay and for good staff members to come and join your company. So it's a win-win basis for this. So the first thing we did was a survey. We followed the Thrive sets out what you can do. So the first thing we did was a survey, and we covered all of the categories that you see below. The highlighted ones were our big sticking points, our big issues that came out of the survey. We found the survey important because it becomes then personalised to your staff members, and it's not just a guesstimate of what their issues are. So we found healthy eating an issue, but people weren't eating the recommended allowance of fruit and vegetables. So as part of the survey, we also suggested how we could help, and we got responses of what they would be likely to adhere to, and then you use those. So for example, free fruit in the workplace was a big, when we were in the offices, was a big thing. So that was one of the first things we did. And the same with physical activity. We saw things like team challenges or on-site activity classes such as yoga. People said that they would be willing to take those up, whereas there was hardly any interest in, for example, any talks or presentations by a health professional. So it's tailored to our members of staff, whereas another group of staff might find that really interesting. What we've delivered pre and post COVID is we created an action plan from the survey that was available to all members of staff to view. As our offices are currently closed due to COVID, we've had to adapt and overcome, but the foundations we created before have put us in good stead to be flexible for the new challenges that basically COVID has presented. So some things we did, just to go through for ideas for people, is we did monthly lunches. We're quite a small office, so we went out for lunch, but you could host them in your workplace. The idea of this was to talk about specific aspects of Thrive at Work, discuss ideas and open the conversation up, allow for informal chats as well as formal chats, and to get people involved in what we were doing. This led to people finding out that people wanted to help with volunteering. So before our Christmas do, actually, this was 2019, we went and worked at a local school for children, and we cleared a patch of land for them to build fruit and vegetable planters on. Those fruit and vegetable planters are now going, but it was a great afternoon for us, and it replaced half of our Christmas do, which we would have been out drinking probably anyway. So it created some social value. We gave back to the community, and I think it was really beneficial for everyone in our office to attend this. Other things we did is we joined the This Is Me campaign and the Time to Change. The key message about this, which was a really big turning point for us, was directors and board members speaking up about their own mental health and leading by example and talking, and it not coming from the bottom down, but coming from the bottom up, coming from the top down. We also sent people on the Mind mental health first aid course. Erin would let me know if they're still running that. I assume they've adapted that online. Yeah, they have. That was amazing because it's given us the opportunity to have people that have an insight and can spot those key challenges of people that are struggling but can't talk or don't feel like they can talk, and also getting people to talk. We went and did yoga classes, which have now switched to, we do them over Zoom. So lots of these things can be adapted in the office, out of the office. We put a rule in, if you've got people still in the office, and I think COVID's impacted this, no tea rounds to help people get up off their seats. We enforce lunch breaks now. We make that a really big thing, especially working from home. Lunch breaks are very important. And another thing that's just as important in the office as at home is display screen equipment assessments. Wherever you're sat all day, it's a massive impact if you have pain anywhere because of your setup. Lifestyles, you can see we've got fruit delivery. We created a running club. We reduced car parking. Before COVID, no one drove into work anymore, which has a massive impact on your well-being when you get into the office. People now replace that with morning walks, lunchtime walks. And then these are just some things we do now working from home that we found really useful. Is we now have a larger well-being team across the whole company. We found it important that this has a mixture of personality types, levels, and is led by a board member. We have informal events that anyone can turn up to. So yoga, we do lunchtime cook-alongs, quizzes. We have an informal coffee break that's just there in the calendar if anyone wants to show up to it. We have WhatsApp groups that aren't based around your your company about work. So we have a running club that people send each other pictures of the runs. We currently encourage 2-hour lunch breaks, and then you add an hour onto the beginning and end of the day, just because of the daylight aspect and getting out and about. And Microsoft Teams we found really important. We've got a file space for people to access information as and when they need it. So that's got lots of helpful stuff, and a lot of that's taken from things like the Mind website, things like that, where people can go if they're struggling, and it's all categorized. And Line Manager calls, any calls that are just not about work, actually have a really big importance at the moment, more so than ever. And yeah, the benefits are, they're seen across our company at the moment. They were seen before COVID, they've seen after COVID. We've got higher staff retention rates, morale's increased. We had a really big issue with presenteeism before, which was where people were staying on working even though they weren't feeling very well. And that's now all, we find that if people are off sick, they're off sick for longer. And I hope COVID sort of encouraged this further, that you don't just take 1 or 2 days off if you've got a flu, you take the full week to recover, to come back and be efficient when you're back at work. And that's it. We just want to say that thank you to Thrive. It's been really positive to our company. And I hope this has given you some ideas that actually it's really easy, but it's all about feedback from everyone in the company, feedback from staff, and adapting. And now I'm just going to pass on to Kelly, who I think has got some more case studies. I stop sharing. There you go.
Thank you, Catherine. Sophie, would you mind? Thank you. Similar to Catherine and Erin, I'd like to share what we've been doing at Wesleyan to support our employees over the last 10 months, but also what our focus is for this year as well. So just a quick intro about me. I'm Kelly Collum. I am the Employee Engagement Officer at Wesleyan. So the remit of my role really is anything to do with employee wellbeing and the overall engagement. And most recently working on our project, which I think a lot of us are calling New Normal. So what is the office and what is the environment going to look like when we are in a position to get back, and really putting like an employee engagement and wellbeing lens on that as well. So initially then, before I kind of get into what our new normal looks like, I'll talk to you a little bit about what we did last year and what we're doing kind of currently still at the moment. So if you wouldn't mind going to the next slide, Sophie. Fab, thank you. Okay, so I suppose similar to what Catherine has just spoke about with kind of doing employee surveys, they have been key to us to kind of really understand what it is that will be most meaningful and relevant to our members of staff. So whilst, you know, personally on my social media channels, there's just like loads of content, amazing videos, articles, posts, different sites that you can follow. It can be a little bit overwhelming at times, and what I was really conscious in my role was that I wasn't kind of just sharing loads of stuff, which, you know, it might be beneficial, but at the same time I just wanted to really hone in on the things that were going to kind of affect our people the most. So the first thing we did was obviously get feedback directly from our employees through our employee opinion survey. So last year was the first time that we did that quarterly instead of biannually. So just doing it every 12 weeks, it just gives like a really good check-in just to kind of see what the feeling is amongst our employees. So we added in new questions specifically around COVID to kind of get an idea of how our staff felt as though we were responding to the pandemic. The communications, were they enough? Was it too much? Was it kind of relevant to them? And things then that weren't they needed more of, so whether it be to do with wellbeing or kind of equipment. So the broad consensus was that employees felt really supported by each other. They said that, you know, in terms of their manager and the support they were getting, they kind of really had a sense of care, and that amongst their peers as well, people were checking in, putting in kind of coffee breaks and lunches just to make sure everybody was okay. And to be honest, that wasn't really a surprise to me. Since we've been doing the opinion survey, our top area has always been peer relationships, and it's something culturally at Wesleyan we're really good at. People are just really friendly, and I was kind of, I suppose, a little bit concerned to begin with as we kind of work remotely, would that change? And it really hasn't. If anything, it's got better, and it's got kind of even more supportive, and we received hundreds of comments from people just kind of sharing their stories about how they have been helped throughout the pandemic. One of the things in the survey that kind of came up that our employees wanted to see more of was around equipment. So to kind of put into perspective, Wesleyan, we have 800 members of staff that were based predominantly, if not permanently, from our office in Colmore Row. So those 800 people then overnight become remote workers, and many of them didn't have employee laptops. They were based on computers in the office because they had no need to work from home. So there was kind of a bit of a huge, well, a logistical challenge in getting everybody set up. And the decision was made quite early on that we weren't going to furlough staff. So we were working through kind of the whole of the first lockdown, and we were hearing anecdotally through managers and through the survey that people's home setups weren't quite right either, and it was difficult. So you've got people that were working on dining room tables with their parents and siblings, and also trying to have calls and meetings. You have, like we are now, people still homeschooling their children, or parents that are caring for children that would have been in nursery while still doing, a fairly demanding job. So that initial support was kind of helping people in kind of getting set up at home most appropriately. So we sent out things like chairs, screens, kind of the equipment that people had at their desk, which make their job just a kind of a bit more manageable. We did like a click and collect service, so you could kind of drive into Birmingham and there was somebody to just put it straight into the boot of your car and then you drove straight home. Or equally, we did courier some people's equipment straight to their house as well, so people had that option. But kind of hearing firsthand on the survey the aspects that people need support with, it made us then kind of be able to really put them into action and to address those things. The other part that we've looked at as well is the data side of things. So looking at our calls to our employee assistance programme in September, so that was about 6 months after the start of the pandemic, and since we'd been working from home, we've seen a 50% rise in calls to EAP, the majority of which were about mental health. And kind of similar to that, the trend was similar with our sickness absence. So in September, the first time in kind of the history of our sickness data, mental health was the leading reason why people were taking time off. So it really kind of did kind of, for a lot of our leadership team and managers, they were aware, but it just kind of really did show the kind of severity of wellbeing and how we really do need to kind of embed it into the business, and that we are supporting people kind of before they need to have time off work. But knowing this data then has enabled us to kind of really put things in place to support our people. So one of the things I'm most proud about is the Be Well at Wesleyan programme. So this year we've launched Be Well, and in fact we were going to launch it anyway this year. It's just with COVID, it really has kind of driven this. So it's all around making it easy and accessible for our people to get the support that they have available to them. So like many organisations, we've got an EAP, we've got occupational health, a team of mental health first aiders, and loads of resources on our learning system and courses. But there's a lot there. Sometimes it can be hard to kind of get your head around what there is at the same time, or what will benefit you. So Be Well kind of groups all your resources into your different kind of categories, if you like. So you've got your wellbeing support, your support for your physical health, for kind of the social aspect, work-life balance, for your financial well-being. So people can kind of, at the click of a button, straight onto kind of our internet page, just see everything that they've got available to them. So accessibility was kind of key for us this year, just making it super, super easy, and also empowering people to take control of their well-being as well. We can give everybody as many resources and kind of sign up to all sorts of things, but if less people feel empowered to actually go on and have a look themselves and really kind of talk to someone or go and find support, then there becomes a bit of a blocker. So we've also introduced a wellbeing hub where there is a series of medically validated questionnaires where our people can go on. I kind of compare it to a bit of like a credit check almost. You kind of complete a quick survey and it gives you a score, and it will then signpost you to the most relevant support depending on your score. So if you've got 100 out of 100 on your, say, energy assessment, even though it's 100 out of 100, it will still give you some support to how to maintain your energy. Equally, if you've got 5 out of 100, then it will direct you to a mental health first aider, your GP, NHS website, so that you can really kind of work on that aspect of your well-being. And there's all sorts of questionnaires, so you can find something that you feel like will benefit you. we kind of encourage people to go on that every 6 weeks, just to kind of check in. And the other thing that's been huge for us is creating an online community. So as with our social life, everything has kind of moved online. And initially, kind of in the early stages, it was driven quite a lot by myself and the engagement team and internal comms. But as time has gone on, our online Facebook for Work page is now just filled with content from all of our employees that are sharing selfies and mindful walks in the morning, that are sharing kind of how they've kind of DIY'd their desk area, so it's a much more kind of like welcoming setup in their homes. And it's just like a place where now people go on and aren't afraid to kind of share their tips or ask for some tips on remote working. Like I kind of said a moment ago, with the majority of our staff being head office based initially, we've got a team of financial consultants that have always worked from home, so they've been really kind of key and really kind in sharing their tips. So as an established remote worker, they've said, your routine is key, your breaks are key, block out your diary, and just really supporting each other. Along with our employee network group as well, they've been great in kind of getting these messages out into actually the business and in the team. So whilst my team will kind of make sure the communication is addressed at like a group wide and a company wide, to then really get it into that team, and the employee network has kind of really supported with that. And in fact, they've been responsible for a number of amazing initiatives, one of them being increasing the number of our mental health first aiders, and leading on some really key awareness days as well. In fact, one of the things actually I want to point out about our mental health first aiders, which I just thought was amazing, was on Christmas Day, with the news that you're not going to be able to travel to see family, they were really worried that there was going to be a lot of people on their own. So they set up at 10:30 till 12, I think it was, an hour and a half on Christmas morning, a Teams, they just called it a Christmas chat. So for anybody that was facing Christmas morning alone, just went onto this chat and just had a really nice friendly conversation. So it wasn't necessarily about mental health, it was just to kind of give people kind of a bit of a smile and a friendly face and a bit of a kind of a Merry Christmas at the start of the day, because we knew how lonely it could be for people. And I just thought, well, wow, that is so kind of kind and selfless. So we've got such an amazing team. And then things like supporting our managers, we've got made mandatory workshops now, so they can have a confident and constructive wellbeing conversation, so they're not shying away from those things, and also supporting people through webinars. So I'll just kind of quickly talk to you through now, I think I've just got a minute or so, about what we're doing this year. 1 minute to go. If you wouldn't mind going to the next slide, Fab. So the focus is continued support. So we're still in a lockdown, so everything that we've been doing, I've just spoken to you about then in terms of kind of the Be Well internal programme, we're still pushing forward with that. Our messages from our leadership this week have been around, carry on talking to your managers. If you need to have emergency holiday or leave at last minute, it is fine, but just talk to your managers. And the next big thing is all around adjusting to our new normal. So whilst we know anxiety was an issue last year for our members of staff with adjusting to working from home, we also know that it's probably going to be a thing readjusting back into the office. So just being as transparent as we can and really addressing the concerns that people might already have about this new normal, and just continuing to embed Be Well. So if anyone has any other kind of questions or wants to connect with me on LinkedIn or drop me an email, I'm more than happy to continue the conversation. But thank you for listening and having me.
Brilliant. Thank you so much for that, Kelly. Both yourself and Catherine provided really, really informative overviews of what it's like to work in an organisation when you've got a really good plan in place. So thank you very much for that. I'm mindful of time. We've only got a few minutes left. So if it's okay, I'm just going to ask a couple of questions. And probably the first one to Michael, if it's okay. We had 58 participants on the call listening into you today. What is the one thing that they can do to support you going forward?
Yeah, sorry, I was off audio. There are so many obvious objectives that we've got, but the one main thing we have at the moment is now we're operating this telephone service, which is overwhelmed. We are desperately in need of obviously training more volunteers to take this way. You can't let anybody just do it. It has to be very carefully organized. It takes a lot of time, so we need more volunteers who be prepared to as it were, man the phones. We're trying to do a 7-day service, 24 hours a day, because there are a lot of calls at night, as you may imagine. And in order to do that, you know, we're desperate in like everybody, we're in need of funds to support that service, because you know, we can't do it for absolutely nothing. So that's our main need at the moment, please.
Thank you so much for that, really helpful. And I think, yeah, hopefully you might get some volunteers through this group, because I think you've got a very active group of people who've taken the time to come on this today. So let's hope we get something from that. So thank you. Erin,
thank you.
Erin, just for you, what one thing do you think that employers can do to support their employees going forward at this really difficult time?
Thanks, Sean. Yeah, gosh, it's hard to pick one thing, but I think for me, because at the moment everyone is going through such a different experience, everyone's home environments are different, the work environments are different, and to feed into one of the questions that I saw came in around, you know, people are on different types of contracts as well. The important thing is things being tailored and suitable for the individual, and for me, that's by implementing wellness action plans and really encouraging people to do those, because that means it's tailored and specific for them, whatever their situation is.
Brilliant, thank you very much. And then Catherine and Kelly, just very briefly, you've implemented a really structured approach going forward. Just one lesson that you've learned each that you would do differently next time if you were implementing from scratch today. Catherine first.
Delegation. Don't do it all yourself. We're small. I'm not HR. We don't have an HR team. Even if you do have an HR team, don't put it all on their shoulders. Delegation actually made people take ownership as well of the mental health that we were doing and the activities we were doing, and they came up with probably better ideas than I could.
It's a same point really, a similar point really. It's since we've seen employees engaging more on our online channels, it's really taken off at that point rather than just relying on internal comms and myself. Another thing I'd probably say is like make sure that this has been driven by your leaders of the business as well. It instantly kind of creates that engagement, and also by putting it on you know, your exec agenda, it really does make a huge difference. So whilst we did do that kind of quite soon into it, so it's not something I'd necessarily do differently, I just know that without that, it would have been very different to embed Be Well.
Brilliant. Thank you so much for that. So I'll hand over to Emily, but just to remind you of the dates that are coming up for you to do something in your organisation. 18th of January being Blue Monday, make sure you make a day of it and think about the well-being of your people in your organisation, both financially and from the well-being agenda. And then secondly is the Time to Talk Day on the 4th of February. Further information is available through Thrive, through Mind, and any of the partnerships here, including Michael's Silence of Suicide. So I wish you all the best, and back over to Emily. Thank you.
Thank you ever so much, Sean. Just to say thank you as well to yourself and to everyone else who has participated and everyone who's joined the call today. I think the actions that I've noted down, obviously to visit the Silence of Suicide website and see how we can support as much as we can. Obviously check out all the resources that were discussed, particularly from Mind and Silence of Suicide, and to look into Thrive, and like you said, note those two key dates, the 18th and the 4th, to make sure we're making the most of everything we can on those days. Fantastic. Thank you ever so much, everyone, and thank you for joining us.